Hey everybody, Dr. Brian Hovis here with Spine Nerve Diagnostic Center. Today we're going to talk about neuromodulation. What that means is how we use different technologies to be able to affect the way that nerves are sending signals. This is a really big topic in pain medicine and a really great way for us as interventional pain medicine practitioners to be able to help patients. Traditionally, what we've seen when we're thinking about neuromodulation is something called spinal cord stimulation, where we actually place a small electrical wire along the backside of the spinal cord to be able to send signals that actually change the way that those signals are being transmitted through the spinal cord, which is a pretty fantastic technology when you think about it. I think an easy way to think about it is correlating it to a pacemaker. Most people are familiar with pacemakers. Pacemakers send a signal to the heart to make sure that the heart keeps beating appropriately. And that's the same idea that we're taking with a spinal cord stimulator, where we're using that to be able to send a signal to the spine and change all of those painful signals that the patient is experiencing to less painful signals. And we actually change the way that our body's creating those signaling cascades. So it's a pretty fantastic technology. Another way that we are able to utilize technology to change pain signals is radiofrequency ablation, which I think some people probably don't consider true neuromodulation, but in my eyes, anytime that we're actually using technology to change the way that we're going to affect nerve signaling, that's neuromodulation. And radiofrequency ablation utilizes radio frequencies and thermal energy to be able to change the way that we are sending signals and sensing pain. So that's a really great way for us to be able to help, particularly with a lot of the facet type of pains, or even when we're thinking about pain coming from a knee joint or a shoulder joint. Other ways that we're able to use neuromodulation are with things such as peripheral nerve stimulation, which has become a really great way for us to early target low back pain, and a way to try to correct that signaling cascade at a very early stage to be able to help with things. And so, long story short, neuromodulation is a fantastic tool that we have as we continue to grow in our use of technology within the field of pain medicine, and it can really help you or somebody like you. So please ask your providers if you think this might be something helpful for you, and we'll do the best we can to direct you in the right ways.